What do you do when you miss a dose of your medication? Or what do you do when you give a medication to a child and the child throws up after taking the medication? Welcome everyone, it's Dr. Bez, your favorite pharmacist, and today we're going to be looking at answers to frequently most asked questions in the use of medications. It's going to be a video series and we're going to be uploading a lot of answers to a lot of questions. So today we're going to be looking into two questions. First is, what do you do when you miss a dose of your medication? And the second one is, what to do when you give a medication to a child and the child vomits after taking the medication. Now, the first one is, let's assume you are giving the medication like this one, probably by your pharmacist or your doctor, and you have taken your first day, your second day, and on the third day, you skipped a particular dose. You did not remember the time you are supposed to take your medication. Now, what do you do? Now, what to do is here. I know some of us will think of, oh, I will double the next dose that I'm going to take. No, don't even think about that. Now, this is what you do. Now, let's assume you are supposed to take the drug by 8 a.m. What you do is, the time you remember, calculate the time you are supposed to take the next dose and the time you are supposed to take the dose that you miss. Now, if the time you're supposed to take the dose that you miss is still within the time you are supposed to take it, the normal dose you're supposed to say. Now, let's say, for example, you're supposed to take your drugs by 8 a.m. and you remember by 9. It's still within the range of 8 a.m., 1 hour. Take your drug. If you remember by 10, within the range, take your drug. Now, if you remember within half of the time that you are supposed to take the next dose, like less than half of the time you're supposed to take the next dose, probably 1 hour, 2 hours, 3 hours for a drug of 8-hour interval, so you can still take it within that 3 hours. But when you remember later, let's say 4 hours later, 5 hours later, and you know that it's closer to when you're supposed to take the next dose, just skip that particular dose and take it as at the time you are supposed to take the next dose. Don't take two. Do not double it. So the first one is, if you remember within the time you're supposed to take it, you can still take it and continue with your 8-hour interval medications. But when you remember later, just forget about it. Don't double it. Take the next dose. Now, the second one is, you give a medication to a child and the child vomits. What do you do? Now, this is what you do. If you give a medication to your child, and let's say the child vomits within 1 hour of you giving that medication. Now, it means that as at that time, the drug has not been absorbed. The drug is still within the system. So anything that the child is vomiting, the drug is actually going to be part of what your child is vomiting. So what you do is wait till 30 minutes or 1 hour after the body must have calmed, administer exactly the same dose that you gave the child before. But if the child vomits like 2 hours later, as at that time the drug must have been absorbed and is already in the system of your child. So what you do is, don't even administer any other thing because the drug has already been absorbed. Just give the next drug that you're supposed to give as at when due time. I hope these answers are helpful to your questions, and also I want you to watch out for next answers to more questions as regards use of medication. You can actually drop a question on the comment section, and when I'm making the next video, I will answer that particular question. It's Dr. Best. See you in my next video. Bye bye.